Hey everybody, it's Dr. Shawn Tassone. Welcome back to another episode of Confessions of a Male Gynecologist. I am your host, board certified OBGYN, integrative medicine physician with a PhD in philosophy, where I focused on mind-body connection. Coming at you from Austin, Texas, where it's currently raining, which is great because we actually need the rain. As I like to do on this podcast is talk about some current events, but mostly current events as they relate to women's health. And sometimes there's stuff out there that's so confusing. I have people calling me all the time, sending me DMs on Instagram. Why is this person saying this and that and the other thing? The newest trend right now, spearheaded by Barbara O'Neill and then her many acolytes out there who like to use pseudoscience to scare the hell out of women to sell a product or to sell their own, stupidity, is the recent attack on pap smears. So I wanted to kind of go through what pap smears are, what they aren't, why we do them, and the whole history behind the pap smear. And I'm going to tell you this. I'm going to be responding to this later this. Well, maybe I did it already this week, but there was a recent influencer out there who was making the claim that pap smears are bad for you, and this is how you know people are ridiculously stupid. She was saying that if you have a different organ, let's say the heart, and you have an abnormal heart rate or something's wrong with the heart, we don't go in and smear the heart. We don't touch the heart. We do diagnostic exams like echocardiograms and EKGs, ultrasounds, all that stuff. So her point was you need to do the same thing. Like you should just go get an image, go get an ultrasound, don't get a pap smear. The stupidity of that statement, the fact that this woman doesn't know the difference between histology and radiology. Radiology is going to give you a picture. The reason we do a pap smear isn't to look at the structural integrity of the cervix. What the hell is that going to tell us? We want to get cells from the cervix. An ultrasound isn't going to detect human papillomavirus. An ultrasound isn't going to detect cervical cancer until it's like stage 2 or 3. You'd be dead. Please don't follow influencers like this who have some, in her video, the whole, there was a thing on the side of the Instagram that said, type detox for blah, blah, blah. Anytime you see somebody that says type detox or type parasites, please run literally as fast as you can away from that account, because that is obviously somebody that has absolutely no idea what they're talking about. Barbara O'Neill, I believe, was from New Zealand and lost her license because of spreading this disgusting misinformation. But this woman is just as bad, and I'll give her name on my Instagram page because I'm going to respond to her ridiculously stupid video. But let's talk about cancer screening. Now, I don't remember the exact years, but I want to say in the 1920s, and I might correct myself later, in the 1920s, the leading cause of cancer-related death in women was cervical cancer. And I mean, how many women do you hear now die of cervical cancer every year? Not many, too many, because it's totally preventable. But I mean, it's one of those things where it's like you just don't hear about it anymore, and that's because of the pap smear. Now, I think in 2022, if I remember, there are about 350,000 deaths worldwide to cervical cancer, but in the United States, it's only about 4,000 women each year. I mean, that's huge. That's a massive difference. And if you look at other cervical cancer statistics, in the United States, the prediction for 2025 is about 4,300 women will die of cervical cancer. And the reason for that is we can detect cervical cancer years before it happens. Right now we're dealing with the whole Joe Biden prostate cancer diagnosis and how everybody's saying, how could this happen? By doing a simple screening test like a prostate-specific antigen. It's similar in the sense that cervical cancer is diagnosed more frequently in women ages 35 to 44. However, it's obviously diagnosed later on in life, but it's rare in women over the age under 20 and probably over 60. The mortality rates are generally not horrible, which is great, but they do affect Black and Native American women more, about 65% more than white women. And I do believe that that is probably due to an access of care for certain races. It's harder for them to get the health care that they need. So basically, we always talk about George Papanicolaou, who is the inventor of the Pap smear. What we rarely hear about is his wife, Mary. And the Pap test was named after her husband, George, but it was Mary that provided basically her body and her willingness to help other women. So Mary Papanicolaou should be the main contributor here along with her husband, but we rarely hear about it. Basically, Mary met George Papanicolaou. She was born in 1890 to a military family. Her great-grandmother fought to liberate Greece from the Ottoman Empire, and she was obviously a Greek citizen. But as a girl, she preferred obviously to go by Mary. Family spent holidays at a beach house a little bit away from Athens, where she met the Papanicolaous. When she was 20, she and George crossed paths and he had just returned to Greece after his PhD studies in Germany, and he found her to be obviously attractive, cultured, and educated per his own description, and became infatuated with her. They eloped, and after a short stint working as a zoologist, George Papanicolaou was conscripted into the army in the Balkan Wars. He came back in 1913. The couple then emigrated to work and study in New York, and they basically moved with like $200 to their name. Neither of them really spoke English. She actually was the first one to get a job sewing buttons on clothes for the department store, while George Papanicolaou sold rugs and did odd jobs just to make some money. I think he played violin at restaurants and cafes. And eventually he got his foot into the research door. So in 1914, he landed a position as assistant anatomist at Cornell. A couple months later, his wife Mary joined him as a laboratory technician, but she did so as a volunteer because they didn't pay spouses at the time. And so if you look at how this happened, George led a project to explore if guinea pig sex was dictated by the X or the Y chromosome. And he needed to get guinea pig eggs just before they ovulated, which was impossible to find out where the guinea pig was in their cycle. So he was just trying to guess. But knowing that the guinea pigs menstruated, he wondered if fluid samples from the vagina could be a signpost. Anyways, he used a really small speculum, you can imagine, on a guinea pig to collect this vaginal fluid daily, and then he would examine it under a microscope. The soup, if you will, that he pulled from the vagina included cells that were sloughed from the surface of the cervix on those guinea pigs. As the days and weeks passed, he was noticing distinct patterns in the size and shape of those cervical epithelial cells in the vaginal fluid. And he felt like he could correctly identify ovulation based on the changes in the cells. And he published this in 1917. Then he reasoned because this is what happens when you do an animal study, then the next follow-up, if you have good findings, is to do it in humans. But the lab that he was in was only licensed to do guinea pigs, not humans. So basically, this then started Mary's basically 21-year investment into the contribution of these tests. She not only willingly donated her vaginal fluid every day, but she also processed and stained her own samples. So you stain them because you want to stain the cells that you can see them. And he was then able to track the cellular changes throughout her reproductive life and into menopause. She eventually then recruited other women to contribute samples, and this bigger trial began around 1925. And then how they were doing it back then was the samples were collected by inserting a thin glass tube that looked kind of like a little skinnier version of a turkey baster that sucked a little bit of fluid out of the vagina. Then George and his collaborator Herbert Trout wrote in their 1943 book on the diagnosis of uterine cancer by vaginal smears. They were talking about this pipelle that they were using. Deborah Bateson, a professor of practice at Daffodil, says while it was a terrible tragedy, it also marked one of Papa Nicolao's biggest developments. And when she mentioned the tragedy was because what happened was one of the women who was in this initial trial, one of Mary's collaborators that came in to help, ended up getting cervical cancer. And so through the fact that this woman had cervical cancer, George was able to see that you could actually see these cells, these precancerous cells. They look different. So he presented this new diagnostic technique in 1928. As usual, the gynecologists at the time thought it was stupid and showed a little bit of interest, but there wasn't this overwhelming support. They thought he was a little forward thinking, but they didn't know what to do with it. And as usual, it took decades for the medical field to start accepting that precancerous changes in the cervix could be detected to help women diagnose this earlier and hopefully get better treatments. So basically, what do we do today? And why do we do it? Okay, so there is this little virus called the human papillomavirus. The human papillomavirus is specifically, women are more susceptible to it for a specific reason. Like, why don't men get penile cancer? And they do, but it's extremely rare. And it's because of the type of cells. So if you look at the penis, it's skin. And skin cells turn over, but they do it at a much slower rate. If you look at the cervix, obviously, because it's on the inside of the body, it's a mucosal barrier. So what happens is you have the cells from the outside of the cervix, and you have the cells coming from the inside of the cervix or the canal, and they meet on the outside of the cervix in an area called the transformation zone. The transformation zone is a highly susceptible area because the cells from the inside are turning into the cells from the outside and vice versa. So there's this constant changing. And what human papillomavirus learned to do was get into that transformation zone and work its way into the DNA, and it then replicates at a much faster rate than it would somewhere else, especially in these HPV strains that are particularly virulent or they cause cancer. There are a lot of human papillomaviruses that don't cause cancer. They might cause mildly abnormal pap smears or warts or things like that. So the pap smear, what we actually do is we put the speculum in. Now there's a bunch of garbage out there right now about how pap smears are toxic because the doctors will sterilize their metal speculums and they put this in your vagina and it's got chemicals on it. Well, first of all, let's say the doctor is using a steel speculum and they're sterilizing it. First of all, how would they go about cleaning it if they weren't sterilizing it? But anyways, I'm digressing. When you sterilize something, that means you're killing everything because of the temperatures. There's nothing left on that speculum. But let's say you're using plastic speculums, which is what I use. They're disposable, they're easier to use. If you have a pap smear every 3 years, do you think the exposure to that plastic for 20 seconds of your life is really going to hurt your health versus the Cheetos that you've been eating for 10 years? I mean, seriously, we're making, again, this is a charge I say against the grifters all the time, is that they take a molehill and they make a mountain out of it to create fear. If the message that you are receiving is a fear-based message, and then use the word detox for my guide, you know that's a grifter. That is part of a marketing formula. You create fear, you then create the solution. So you're building a mountain out of a molehill, you're scaring the bejesus out of women, and then magically you have the cure. That is a classic marketing 101. I've been in enough masterminds in my life, especially in the wellness space, to know how this works. You get unscrupulous people that will take this formula and they'll make millions of dollars out of it by creating fear. So we know that cervical cancer rates have dropped dramatically. Cervical cancer is now probably not even in the top 10 types of cancers that women die from. And that's because of the pap smear. Now, do we do too many pap smears? Yes, I do believe that. We probably don't need to do them once a year, but that's okay. Let's just say a normal population of women who practice safe sex, because obviously the way that you get human papillomavirus is through intercourse. Now, 99% of the time, your body probably fights it off just fine. You make antibodies to that particular strain of virus and you're fine. Your body clears it. And I'm going to go through pap smears in just a second. But what these dodos who are promoting fear don't even understand is they don't understand the point of a pap smear. The point of the pap smear is so you can actually get cells. And we're putting this little spatula on the cervix and we're twirling it. And then we get a little bit of sample from the lining of the uterus. It literally takes 10 to 15 seconds. It shouldn't be painful. If it is, then they're doing it wrong. I've done pap smears tens of thousands of times. It should not be a painful process. And for some women, it is, because the muscle tone, history of being abused or something along that. So it can be a horrible experience for some women if they're not in the right mindset. So I really, my heart goes out to those women. Hopefully you can find a physician that can walk you through it in a way that you feel relaxed. But let's say you have normal history, you have a normal sexual history, and you have normal pap smears. If you do a pap smear once every 3 years, you're probably fine. If you're a woman who's had an abnormal pap smear, you have multiple sex partners, you've had treatments on your cervix before, you probably would be better off to do it once a year until your doctor tells you can start spacing it out. And then the question is, well, it must not be a very good test because you have to do it over and over again. Well, that's because you live your life and you do things. But here's the ultimate truth. If you just did one pap smear, the chances of the pap smear missing a cancer are about 33%. So yeah, it's a screening test. That's the whole point of a screening test. Screening tests are not known to be super sensitive or specific because they're a screening test. Therefore, if it's a screening test and you do it over again, it gets more accurate. So one pap smear has a 33% chance of missing something, but three pap smears, that goes down to 5%. So if you can get repetitive results, 3 pap smears gives you a 5% chance of actually missing something, which is great. Who doesn't want to know that? So if you do a pap smear, I talked about how we scrape the cells from the cervix. The theory being that you're spreading cancer and it's destructive. That is complete stupidity. That is like literally maybe one of the dumbest things I've ever heard. Doing a pap smear does not spread cancer. Doing a pap smear, there are some women that will have a little bit of spotting. Usually that's because they already have inflammatory things going on with the cervix and you could barely touch it with a Q-tip. And it would bleed. So that's not abnormal. And usually the bleeding probably stops by the time you get home. But let's talk about the pap. So pap smears can return with different results. It can be negative, which is great. And most of the time, it does come back negative. A step above a negative pap smear, you might pick up something like chlamydia. They could pick up trichomonas or bacterial vaginosis. These are all more of infectious problems. Yeast sometimes will come back on a pap. And they can be treated easily with antifungals or antibiotics. A step above an infection would be what's called an ascus pap smear. Atypical cells of undetermined significance. This means they looked at it under a microscope. Doesn't look completely normal, but it also doesn't look abnormal. So they didn't know what to call these. So they call them ascus pap smears. Then what they do is they go and they look for HPV. So if you get an atypical pap smear that's HPV negative, the current recommendations would be to repeat the pap in 12 months. And that's what I'm talking about. Those women wouldn't wait like 3 years. They would go do their pap in about 12 months. If it comes back as ascus, atypical cells of undetermined significance, and then it has HPV, and it's a high risk HPV. As I told you, there are certain HPVs that are more virulent. They grow quicker. They do nastier things. The recommendation might be for what's called a colposcopy, or it could be something called just a repeat pap. The doctor might say, and here's why: because 80% of abnormal pap smears will resolve on their own with just waiting. The body is an amazing organ. It has ways of fixing itself. The white blood cells come in, they clean it out. Your body's in a constant state of battling with fungi, bacteria, viruses, cancer cells, constantly turning stuff over. So sometimes if you just leave the body alone, you eat a good diet, you exercise, you take care of yourself, your body will clear these things on its own. So let's say it comes back as what's called a low-grade intraepithelial lesion, or LCIL. If it comes back as LCIL, the immediate response is going to be a colposcopy. Now, occasionally I will have that conversation with a woman who's just deathly afraid of a colposcopy, and I'll say, well, let's wait 6 months. If it's 6 months, the LCIL is still there, this low-grade lesion is still there, then I probably would recommend a colposcopy, and I'm going to talk about that in a minute. There's also what's called HSIL, high-grade squamous intraepithelial lesion. Definitely, if the pap comes back as HSIL or HGSIL, you definitely need a colposcopy. And here's why. The pap smear, as we mentioned, is a screening test. It has false positives. It also has false negatives. So if it comes back as a positive, we want an actual tissue diagnosis. We want the actual cells to see what's going on. And this is where this lady who made this god-awful, stupid video talking about the heart and how we don't biopsy the heart. Well, if we think there's cancer on the heart, we may actually biopsy it. So that's, first of all, that's wrong. And second of all, she doesn't even understand how screening tests work. So a screening test, like the pap smear, just raises a hand, a red flag, like, hey, there might be something here you might want to check out. So let's say it's HSIL, high-grade squamous intraepithelial lesion. You go for a colposcopy. The process of colposcopic evaluation is to get an actual histologic specimen. So the pap smear is called cytology. You get some cells on a smear, you look at it under a microscope. The pap smear is actually the histology. Histology is an actual cell, a biopsy. So what happens is you put the speculum in the vagina, you see the cervix. We then put vinegar on the cervix because vinegar, what happens with abnormal cells in the cervical area, if you put vinegar on them, because they lack glycogen, which is a sugar, a storage form of sugar, they blanch white. So when I'm looking at it, I have a pair of binoculars attached to a pole, and I put the vinegar on your cervix, and I'm looking at your cervix under this microscope. If there's any little areas in that transformation zone that I just talked about, then we're going to do a guided biopsy of that space. Now, it might just be one biopsy. It could be 3 or 4. We're seeing a lot of information coming out now about how women need to be offered more pain control. I can tell you I've done thousands of colposcopies. What I tend to do first is I will go up with the little device and I'll grab the cervix and I'll squeeze it. If she says, yes, I feel that, then I probably I'll give her the option of doing it with injections. If she doesn't feel anything, and keep in mind, the cervical innervation is different than your fingers or your hands or your skin. It's not as profound. Some women, that's not true, and it is very profound, and they feel everything. In most women, it's not. Many women can do a colposcopy without injections. Now, the reason that I bring this up is because sometimes the injections hurt just as much as the biopsies. So if we have to give you 4 shots into your cervix, you could just have been done with the biopsies at the same time. So it's not that I think most doctors want to hurt women. I actually don't believe that at all. I think they're looking at it along those lines saying, well, maybe it'll hurt just as much. Now, we should still give you that option. I do believe that. And many doctors don't even give you the option. So I have a problem with that. So you should be given an option. It shouldn't hurt. It shouldn't cause stress. If it does, then find somebody that you resonate with that might give you a different option so that you don't have that fear, so that you don't worry about that, because we won't know what's going on with that cervix unless we get a result. So we have the screening, pap smear. We then have the diagnosis, colposcopy. So we went from screening to diagnosis. Now, there's different ways these biopsies can come back. You can have negative, which is great. All systems clear. Go back to your pap smears once a year. But then what happens is you get a diagnosis called dysplasia. Dysplasia is a precancerous cell that's not cancer, but it's on that precancerous step. You can get mild, moderate, or severe dysplasia. Obviously, the way they diagnose that is how far down and how abnormal are the cells. So is it superficial? Does it go deeper? Does it go all the way down to the basement membrane? So severe dysplasia are also called carcinoma in situ, meaning that's cancer, but it hasn't invaded that basal membrane yet, so it's not invasive. Mild dysplasia, about 70% of those, if you don't do anything, will go away on their own. So if you're one of those folks that likes to just wait and see, then you do another pap smear in 6 months. If the pap smear is still abnormal, then you could opt for treatment. If you have moderate or severe dysplasia, once the dysplasia goes up the scale a little bit, the chances of it resolving on its own go down to about 30%. And as doctors, we don't like that, because if we know something is there, right or wrong, we want to get rid of it. We want to get rid of it for you. So the treatment for moderate or severe dysplasia could potentially be something called a LEEP procedure or a LETZ procedure, LLETZ or LEEP. Loop excision of the endocervical area, or large loop excision of the transformation zone. So what we're doing is, and you can do it in the office, you can do it in the operating room, however you want to do it. You inject the cervix with numbing medicine. You let it sit for about 5 minutes after you put the speculum in. And then we have this little long wand, and at the end of it, there's this little metal wire loop. The wire loop has electricity that goes through it, and we pass it and we just turn it, and it cuts out that transformation zone. It literally excises that whole transformation zone in a cone like, so we're getting actually cells that go up into the endocervical canal as well, so we can just make sure that it isn't hiding up a little bit higher. That is also treatment. So you've got screening, PAP, diagnosis, colposcopy, treatment, LEEP procedure. If you excise all the way around these abnormal areas, you're cured. Now, the thing being, let's say you have HPV 16 and it's caused severe dysplasia. We've excised 99.9% of that HPV 16 and those abnormal cells. That is a treatment. Your body already has antibodies to HPV 16, but for whatever reason, it couldn't fight it off. But now that we've excised about 99.9% of it, and you're with the same partner, because I'll tell you what, he's got HPV 16 because he loves you and because you've had sex and you've passed it back and forth. We're not clearing it from him. We cleared it from you. So you're going to get re-exposed. You're going to get HPV 16 back in the vagina after we treat it, if it isn't already still there. But because you have an army of antibodies waiting for it and 99.9% of the opposing army is now gone, your cells will destroy it, and usually you won't get it again. Women that have recurrent pap smears, they either didn't have the whole thing excised, it's extremely virulent, or they got a new one. They got a new strain of the virus that their body has never seen before. So here's the thing. Pap smears are a relatively small investment that you could do in your own health. They're unpleasant. Every woman I've ever done a pap smear on pretty much says she hates it. That is my normal mental history evaluation. If you don't like the pap smear, that means you're totally normal. But I do think we do pap smears too frequently. It used to be we would do them once a year. That was pretty much the routine screening protocol. I think if you are a woman between the ages of 21 and probably 70, you have a stable partner. I think every 3 years is fine. I still think you should go in for the pelvic exam, which is the actual physical exam, and a breast exam once a year. I think that's always a great idea. But the only thing you need the speculum for is the actual pap, and that's probably not necessarily, but every 3 years. Now, if you've had an abnormal pap smear in your history, you were treated for abnormal cells, you might want to get it every year. It also depends on, remember how I said if you do 3 in a row and they're negative? If you've had 3 pap smears in a row and they're all negative, you might be able to go to every 3 years. That's a discussion between you and your physician. But I usually tell women that, like, hey, it's been 5 years. I think we're fine to go back to every 3-year screening. But that's definitely a discussion you need to have with your doctor. Please, please, please get pap smears. I mean, it's again, the process of making a pap smear, there's always something with these people. So these health influencers, they have to find a new topic every 2 to 3 months, because otherwise they'd be completely irrelevant. So what they do is they come out with something that they heard. This woman that I'm going to roast this week, she actually has absolutely no idea what she's even talking about with the way screening tests work versus ultrasound. And to me, that's a huge red flag that she's acting like an expert, but she really doesn't even know what a pap smear is. My guess is she heard the video from Barbara O'Neill and she's trying to cash in on Barbara's notoriety. But whenever somebody acts like they know something that the medical establishment doesn't know, pap smears have been around now for about 100 years, and they're invasive in the sense that we have to put the speculum in, but it's really quick and it can give you a lot of peace of mind and a lot of good information. No woman should ever die from cervical cancer if they get their pap smears. It just never should happen. And I think it's a misconception too, created by these monsters that say that biopsies spread cancer. How else are you supposed to know you have cancer if you don't actually get a tissue diagnosis? So don't listen to these people. If they say things that you're just like, huh? And the kooks are following them saying, preach, sister, or death to the patriarchy, blah, blah, blah. The pap smear was basically given to you by a woman. She did most of the work. So it's not necessarily the patriarchy. Unfortunately, the patriarchy, the man took all the credit for it, but it was actually from the women that volunteered to donate their time so that other women wouldn't die from cervical cancer. Pap smears are super important. They're super easy. And the misinformation out there is just purely created to sell you some stupid detox formula, or there's no other option. Like this lady said, oh, well, just do an ultrasound. An ultrasound, as we've seen, is going to show you structure of the cervix. It's not going to give you histology. It's not going to give you cytology. It's not going to show you cells. It just shows you if you have a cyst on your cervix. Who cares? That's not what we're looking for. We're looking for precancerous cells. So this woman is obviously dangerous. I think the information given by Barbara O'Neill is dangerous, which I probably think most of what she says is. I'll probably lose followers for that, but I don't care. So how do you work with me? Well, let's say you want to do hormones or anything. I'm licensed in about 42 states in this country. If you call the office at 512-956-0296, I'm more than happy to do telemedicine visits. We can order labs wherever you live. I will be more than happy to do that. Otherwise, if you want a good starting point, you can always go to Amazon, get a copy of my book, The Hormone Balance Bible, through HarperCollins Day Street. It's 500 pages, 12 most common hormone imbalances in women. I'd love for you to check it out. In the meantime, stay healthy, get your pap smears, and don't listen to the grifters. Take care.